Dentistry is like the perfect mix between science and art, and where medicine intersects everything that makes us us. The first thing we do when we meet a stranger is we smile. People who are confident in their smiles and feel good about themselves, they're happy to just, smile and wave, and you can see it in how they carry themselves. Well, I was always artistic growing up, and so I always liked to draw, paint, use my hands. I came honestly by it, both sides of my family. I was a senior in college. Dentistry wasn't really on my radar at first. I knew I liked medicine and I liked that aspect of it, but I really hadn't thought much about dentistry. And so when it came to my mind that this could be a possible career, I pretty much dove in with both feet. Wrapped up a 4-year program in 2 years and pretty much powered through to dental school and beyond. When you do dentistry, they basically throw you in and say, okay, here you go, sink or swim. You go from this carefully curated patient experience where people are selecting your patients for you to being thrown in the deep end and being asked to make all these decisions yourself. This office has enormous potential. I mean, it always has. It's a fast-growing area. It's a community with a lot of families, a lot of people. It's in close proximity to some major metropolitan areas. I was intrigued by the process of establishing myself here as a dentist and in this community. Two main types of anxious patients that walk through the door. First, you have the patient who maybe hasn't been to the dentist in a while. They go in and they have a lot of fear and anxiety, and also, they're ashamed. They're ashamed of their smile. And then the other one is maybe they had a bad experience as a child, or they had a bad experience as an adult, or maybe they got overwhelmed by a pricey treatment plan in another office. So we really try to take it back to basics. What are they coming in for? What is their main issue? And we start there. And then from there, we can build on to other things that might affect their overall smile and their overall health. Patients are concerned about three main things. How much time is it going to take? How much is it going to hurt? And how much is it going to cost? And so what we try to do is we try to work with them. It's really, the doctor-patient relationship is a partnership. We're working with patients to determine what is their biggest concern and how can we address that concern in such a way that they really feel comfortable here and that they want to move forward with treatment. Patient trust, that the number one reason that patients agree or don't agree to do treatment is trust. I want a patient to feel like they've been heard. I want a patient to feel like when they walk in, comfortable, that they have the confidence and trust in us and our ability to deliver what options we're trying to give them. And I want them to feel like when they leave here, wow, that office really made me feel good. Let me go ahead and, tell my friends about it and bring my family in. That's the kind of experience we want to deliver.